Hi, my name's Kale Evans. I'm an LPN nursing student here at Wilson State College, and today I'm going to be doing a postpartum assessment. So before I go into my patient's room, I'm going to knock and introduce myself and perform hand hygiene. So, hi Shirley, how you doing today? Good. Okay, my name's Kale. I'm going to be your nurse today, and I'm just going to do a quick postpartum assessment on you. How you feeling since you had since delivery yesterday? Good. How's your transition to motherhood? Okay, so I see Shirley Coast 54 female, 5/14/1964, and I just had my patient confirm that, so she confirmed it for me, and then I see you're allergic to codeine, is that correct? Yeah? Okay, perfect. So, before I get started with the assessment today, I see that you have family in here. Is it okay if they stay, or would you like them to give us some privacy? You like some privacy? Okay, so the patient's family has left. I've closed the door and drawn a curtain to make sure that we have privacy. And so I'm going to continue with my assessment. So Shirley, do you see doubles of anything? Are you seeing rings around lights, or do you have a headache or anything like that? No to all the vision, but you do have a little bit of a headache. Okay, so have we been giving you some medications for that? Yeah, and you haven't had some in a little while? Okay, so when I leave, I'll go and check the MAR and make sure if you have some medication coming your way. And you said you're getting, what was it? Ibuprofen? Okay, so I'll make sure to make a note of that. So I'm just going to start my assessment with the breast exam. So I'll just make sure to perform hand hygiene and glove on. And I'm just going to pull down your gown here just so I can examine your breasts, okay? So I'm just going to make sure that there's no redness or swelling, so the breast looks good. There's no bleeding anywhere, but there's a little bit of cracking around the nipple. And then I'll do the same for this breast as well. So there's no redness, swelling, or bleeding, but there's a little bit of a crack, some cracking on the nipple. So I'll cover my patient back up. And so there's just a little bit of cracking on your nipple, Shirley, so I'll just make sure to go and get you some lanolin. It's a cream that you can just apply to it. It won't affect them breastfeeding any at all, so you can still breastfeed with baby. And then the next time that you breastfeed, I'd like you to use your call light so that we can come in and make sure that baby's latching on and right and good, okay? Perfect. So I'm just going to lay you down here, and I saw that you had a urinary catheter yesterday and it's been taken out and you've been voiding good. Have you been having trouble going to the bathroom at all? No? Okay. Have you been passing gas at all? Yeah. Have you had any bowel movement since the surgery? No? Okay. So the doctor did order you a stool softener. That's just to help with that first bowel movement, come through and make it good and easy and pain-free. So when I come back, I'll come back with the stool softener as well. And so this patient had a C-section, so I'm just going to assess the incision. So I see that the patient's incision is equal, and it's not red or it's not swelling. There's no discharge or anything like that. So I can make note that the incision is looking fine. I'm going to make sure to check the patient's pad. So I see that there's a scant amount of blood on the patient's pad. When was the last time you changed your pad, Shirley? It was 2 hours ago? Okay, so this is it's a fair amount of blood for a pad after 2 hours, so we don't need to worry about it. So I'll just leave the pad here while I do the fundus massage. So I'm just going to place one hand here for support and place my other hand about right at the umbilicus line, and I'm just going to massage in a wave-like motion until I start to feel the fundus firming up. And while I did this, I can see a little bit of blood came out, and it's a fair amount, so it's fine, we don't need to worry. So that I can take this pad, make sure she's clean, use Pericare, throw that away and apply a new pad. So I'm just going to take my gloves off and cover the patient back up. And So Shirley, when you go home, I just want to make sure that if you're when you go home, when you change your pad, if you have to change your pad and it's fully bloody for a pad an hour for 2 hours, please make sure to call the doctor. Also, if you have any clots that are larger than the size of the eggs, if the cracking in your breasts get worse, please make sure to call the provider as well. And if you see any form of infection on your C-section line, make sure to give us a ring. So if you see any redness, swelling, if it starts to discharge or anything like that. And then your discharge out of your vagina, it is going to go in 3 stages. So it's going to start out pretty red, pretty bloody, and then it'll go down to a pinkish, and then it'll go down to a white. If you see any reversal in that line, so if it goes from one day it's pink, then back to red, make sure to give us a call. So I'm going to change this patient, and it is now a vaginal birth. So I'm just going to perform hand hygiene again, and then I will re-glove up. So with this patient, they had a small tear, so I'm just going to go in and with their birth, so I'm just going to go in and assess that tear. So I'm just going to have them roll on the count of 3. So 1, 2, 3. Okay, and then to make this assessment, I'll just make sure to spread the buttocks nice and gently. I see that there's no drainage, there's no pooling blood, that there's no redness, and it's not warm or anything. There is a little bit of swelling, so I'll make sure to get an ice pack for that. And the patient told me that she does not have a history of hemorrhoids either, so that can all check out fine. So once I get the patient back laying comfortably, I can then take my gloves off, and I can check for some edema. So I'll just roll the blankets down here, and I'm just going to check the patient's legs. So Shirley, how you doing? Do you think that your legs are feeling a little swollen? Yeah? Okay. Do you have any pain in your legs whatsoever? No? Okay. So there is 2+ pitting edema bilaterally, and then I'm just going to check the pedal pulses, and they are strong and equal bilaterally also, so that's good, and that's perfect. So we'll make sure to cover the patient back up, and then so Shirley, I just want to make sure to inform you that after having a baby, you can start feeling a little sad or depressed. This usually lasts up to 10 days, so if you have thoughts of harming yourself or thoughts of harming your baby, please make sure to call 911, and if those feelings last any longer than those 10 days, please call your provider, and we can help you with that. So if you have any other questions for me, I'm open to them. If not, I will go out and get the MAR. I will get you some ice for your swelling. I'll get you your stool softener, and I'll get that ibuprofen for you for your headache that you had. Is there any other questions for me? No? Okay, so I'll perform hand hygiene for the last time and walk out of the patient's room and go and document